entitled to those.
I'm not an expert on the rules of what's disclosed and what's not, but my counsel is, and he'd be happy to talk to the committee about it.
Why will you not give us those documents?
I've not concluded one way or another in the document.
Who owns those documents? Who paid for them?
I'm not sure.
You don't know who paid for those documents? Were you paid by the American taxpayer?
You answer questions better than any politician sitting at this dais today. And it's frustrating, and I would contend that your attorney is not giving you adequate representation at this time. This committee has the right to have the information that has been requested. And you have progressed from not talking simply off the cuff and making stupid statements to now being entirely political, to the point that you're hindering us in carrying out our responsibility. I now recognize the gentleman from...
Mr. Chairman, I would ask the chairman if this committee should consider a subpoena to compel the witness to provide this kind of information if he's not going to do it on a voluntary basis.
Well, I would recommend the gentleman take that up with the committee chair, whose portrait hangs behind us. I certainly would concur with you, but I'm not going to step in the place of the full committee chair at this point.
How often did you go to the Romney administration offices of any kind when you were advising the Romney administration on what became really the model for Obamacare?
I don't recall exactly, dozens of times.
Dozens of times. Did you ever meet with Governor Romney?
I had one meeting with Governor Romney.
Just like you had one with Obama?
Yes.
So did that make you an intimate of the Romney administration and the architect of Romney Care in Massachusetts?
I was an economic advisor to Governor Romney just as I was to President Obama.
Thank you. And do you have documents from those years that we might want to subpoena? Well, let me withdraw the last part. Do you have documents from the Romney period?
Probably.
Well, I would hope, Mr. Chairman, that if we're going to have a broad subpoena, suggested by my friend from North Carolina, that it be indeed broad and that we encompass all of the Romney documents Dr. Gruber was involved in, because I certainly want to see whether this is a pattern. Shouldn't be limited just to President Obama, because after all, there is an antecedent. Not just an antecedent, Romney Care was the model for Obamacare. Is that not true, Dr. Gruber?
I believe it's true.
Ms. Tavener, do you believe Obamacare was crafted in a way that was transparent to the American taxpayer?
I certainly believe that the work that I've been a part of for the last 5 years has been transparent.
Was Obamacare crafted in a way to be transparent?
I was not here during the crafting of Obamacare.
Ms. Tavener, would you say the administration is transparent in its implementation of Obamacare then? You've been here for that.
Yes, sir. I think we have tried to be transparent, and we've tried to provide documents, including the documents that we sent yesterday. To date, we've already provided 135,000 pages of documents and provided more than a dozen transcribed interviews. So I think we have tried to be transparent.
But not completely.
Wherever we can, we have been transparent.
Wherever we can. Okay. Another term that could be used in this hearing, whenever we can. I don't recall, probably. Those are reoccurring terms. Mr. Gruber, the Obama administration promised the American people 37 times that if you like your plan, you can keep your plan. When you were working on the law, did you believe, Mr. Gruber, did you believe that no one would lose a plan they liked due to Obamacare?
I believe that the law would not affect the vast majority of Americans.
The vast majority? But did you believe that no one, as the President said, would lose a plan they liked?
As I said, I believe it would not affect the vast majority of Americans, but it is true that some people might have to upgrade their plans because their plans were not comprehensive as defined under the law.
So they couldn't keep their plan even if they liked it?
What the law says is there's minimum standards to be met.
Why did the President make this representation if his experts, including you, knew it was not true? That some, as you've said, would not be able to keep their plan. They would have to upgrade or they'd have to change it?
I'm not a political advisor, and I have no answer to that question.
You acknowledged in a 2013 article in The New Yorker that not everyone who liked their plans could keep their plans, Mr. Gruber. When you knew that the administration's representations to the American people were false, such as in this instance, did you ever voice any concern? Why or why not?
I interpreted the administration's comments as saying that for the vast majority of Americans, this law would not affect the productive health insurance relationships they have. And so I did not see a problem with the administration's statement.
But you're an economist with a model that you described as entirely accurate. You're a learned professor, and we don't take that away from you at all. And yet, the President 37 times said, if you like your plan, you can keep your plan. I'm here today to say that in my constituency of almost 800,000 people, Julie Boonstra, a leukemia patient who had a plan she liked, couldn't keep that plan. And she's not stupid. She couldn't keep that plan. Mark and Kate, a young pastor and wife at a local church, now expecting, as of yesterday, cannot keep the plan they had and can't find a plan that's adequate for them to replace it. Dustin, a hardworking young man in my district, spent almost the entire weekend trying to up onto Obamacare from a plan that he lost, he couldn't keep. And as of yesterday morning, I watched him try to get a plan through the website. Through talking with people connected with the website, he still couldn't get it. He had a plan he liked. He's not stupid. He couldn't keep it. Numerous constituents have contacted me saying that while they may have found a plan under Obamacare, not necessarily a plan that they liked or they could keep, but found a plan like Mr. Goldman that was reasonable in cost, yet when they got to the point of having to pay their deductibles, their co-pays, their out-of-pocket expenses, or the prescription drug costs, they couldn't afford it. And I would suggest that, again, transparency here is what you see is not what you get.
Did you think that there would be such a large number of folks that would lose their health insurance?
I don't know the exact number in North Carolina, but
well, it's 473,000 according to the Department of Insurance and the Raleigh News and Observer.
What I was focused on was the net increase in newly insured we've had under the law, which has been quite substantial.
Okay. So it's not relevant to your calculation that there would be people that would lose their health insurance?
That was part of the calculation.
It was. So there is churn, would you say?
There's always been churn in this market.
Sure. Did you think it would be such a large number that would lose their plans, though?
I don't recall the exact numbers I modeled, but we did model that some individuals would lose their existing plans and move to new forms of coverage.
Well, I think you anticipated, and you're obviously very well prepared. I think you anticipated this question. Is it similar or dissimilar to the number that you calculated?
I don't know of a national estimate of how many people have lost health insurance, so I don't know how it compares to what I projected.
So was there a discussion at senior levels in the White House and HHS about this potential loss of people's health insurance plans?
I don't recall whether they were. When I was there, I can't speak what happened when I wasn't.
So was there was no moment of moral clarity, of honesty, that you came to publicly, that we now know about and most Americans know about? There was no discussion at the time that maybe we should put the brakes on this, that we're going to have a lot of people lose their health insurance plan, their preferred health insurance plan?
I was present for discussion. As I said, I provided numbers. I was present for discussion of those numbers and interpretation of what they meant in terms of how the law would affect individuals.
Did anyone say, well, pause for a moment. The President's been out saying if you like your health insurance plan, you can keep it. gosh, maybe we should tell him that that's not in fact the case. Maybe he should change his wording a little bit.
I was not in any discussion of presidential communication or messaging.
Okay. But in the meetings where you went through these numbers and you said to the administration, and look, you've got plenty of experience on this, you said to this administration, because you're in the employ of this administration, you said there will be people that lose their plans, right? Now, you said there are also going to be people that get other plans, right? But you said there will be people that lose their plans. Was this not registered? Did this fall on deaf ears?
All I know is what my modeling showed and what I conveyed.
And you conveyed that there would be, in fact, people that lose their preferred health insurance plan.
I conveyed that there would be churn in the market and some people would move to different insurance plans.
So as I said before, my interpretation of churn is that some lose and some gain. So when you have the president going out saying clearly, if you like your plan, you can keep it, it was in fact a lie, based off your numbers, based off the data you provided this administration. Is that correct?
I interpreted the president's statement as referring to the fact that the vast majority of Americans would be able to maintain their health insurance arrangements under the Affordable Care Act.
So you were in your element when you were talking about the critiques of this health care law. Let me ask you something. So who helped you with your testimony today, and who signed off on your testimony today?
No one signed off on my testimony. It's my own testimony. I did receive assistance from my counsel.
Did you also have assistance from HHS, the administration, the minority staff committee?
No, I did not.
Okay. Now, were you coached in any way what to say?
The words that are written, I said, are my own. As I said, I did work with my counsel in preparing them.
Okay. So when we had numbers of my colleagues asking you in regards to numbers, you're pretty astute with numbers, right? You know those numbers.
Once again, the numbers that I produced in terms of my microsimulation modeling, I'm very confident in.
Ms. Tavener, you're also pretty good with numbers, aren't you? I mean, I've been watching the bantering back and forth, and when the other side asks you a question, you're very prepared with numbers. But when we ask you a question, you're very inappropriately responsible to numbers. But you're very good with numbers because you hear them all day long, do you not?
I do hear numbers.
You do, I agree. So, you know, this preponderance of looking at the falling rate of dollars being spent in healthcare, I'm going to go back to the microcosm called dentistry. Did anybody even think about this? I mean, what kind of access? The gentlelady from New Mexico talked about access. Did that ever come into your aspect that the deductibles are so high in the dental aspect that no one's using them? Did that ever occur to you?
You know, if you look at what we did around the dental proposed and final rule last year, we actually tried to make some accommodation there to handle the deductible to improve it, if you will.
Well, that's nice. I mean, you know, changing around some of those aspects. But, you know, from my standpoint, when people don't actually get care, you're actually creating a bigger problem. Okay? You know, the gentleman from Maryland is aware of the Damani driver aspect. When people can't pay for it, it reduces access. Children go walking around without getting health care, and all of a sudden we have a child that dies. You're aware of that situation?
Yes, I'm aware of the situation that occurred.
So once again, it becomes that fluff part, you know, because I heard people on the other side over here saying this was the most transparent process. Really? It didn't involve anybody on this side, and I'm very well aware of having, you know, a bipartisan type of application to health care, because health care is a personal sport. The patient has to be involved, and it's not a Republican or Democratic issue, but it became a very Democratic issue. They used reconciliation and a lot of gimmicks to pass it. We were deceitful in everything that we've done. I mean, everything. Instead of acknowledging the problems and being truthful on it, we hear tortured language, you know, from the gentleman to your left. This was outright the wrong way to go. From that standpoint, it sickens me to actually hear what I heard today from both you and from Mr. Gruber. It's sad, you know, that we're playing with people's health care when they deserve something better. And frankly, not having the facts is disdainful. Congress has a right to those facts, that we've seen this perpetually with this administration, from Fast and Furious to Benghazi to here to the IRS. It's disdainful.